Hi, I'm Manjari Bagul, an intern from Vedic Dental College. My topic for today is chin cup. So let's start.
So chin cup, we'll start with the introduction first. It is also known as chin cap. It is an extraoral orthopedic device that covers the chin and is connected to the strap taking support of the skull bone. So here you can see in the picture that the chin cup is covering the chin, that is it is engaging the chin area and it is connected to the strap, and the head cap is taking support of the skull bone. Normally, the occipital and the parietal area are being engaged. It redirects the growth of mandible to obtain a better anteroposterior relation between the two jaws. So, mostly the chin cup is being used in skeletal class 3 patients with prognathic mandible. So, the prognathic mandible is redirected to obtain a better anterior-posterior relationship between the maxilla and the mandible. Now, what are the components of chin cup? The components are head cap, adjustable elastic strap, and chin cup. So here you can see in this picture, here it is labeled head cap covering the parietal and the occipital area, the elastic strap connecting both the chin cup and the head cap, and this is the chin cup.
So, this is a chin cup. This is a preformed chin cup that is going to rest on the chin area. This is the head strap that is going to rest on the head area. This is an occipital full chin cup that is engaging the occipital region of the head. This is a elastic strap. By engaging the elastic strap, we can adjust the force accordingly.
Now, what is the basic chin cup appliance design? So, head cap, which is firmly seated on the posterior superior aspect of the cranium as anchorage unit, has attachments for engagement and activation of the chin cup. Now, why this head cap? Here it is written posterior superior, because posteriorly it takes anchorage from the occipital region and superiorly it takes anchorage from the parietal region, and it has attachments, right, for the engagement and activation of the chin cup. Now it consists of the following components, that is force module, elastic or metal spring that provides the desired tension levels on the chin cup. So the elastic strap or the force module which was there, it is engaged at different levels, or it has been stretched and the desired tension levels are created so that the desired movement can be achieved. The chin cup can be custom made or preformed. It can be hard or soft. So here you can see in the picture, this is a hard cup which is made from plastic, and this is a soft cup which can be made from a football helmet chin strap, right? A commercial metal or plastic cup can be used if it fits well enough, right? So commercially also metal or plastic cups are available, and you can also make custom made for each patient. Soft cups provide more tooth movement than the hard ones. So this one provides more tooth movement than the hard ones. Now let's move forward to the uses. It is used in to restrict forward and downward growth of mandible, that is in cases of skeletal class 3 patients due to prognathic mandible. Now, what are the indications in class 3 patients having mandibular prognathism and normal maxilla? So, why this indication has been given? Because the class 3 patients, they can be due to prognathic mandible, they can be due to retrognathic maxilla, or due to both. So chin cup is given only when there is case of mandibular prognathism with normal maxilla and not retrognathic maxilla. A mild skeletal class 3 problem with the ability to bring the incisors end to end or Nearly so. Short vertical face height, normal position or protrusive but not protrusive lower incisors. So why these 2 points are given, I'll explain you in the next slides. Now the relative contraindications is patient with long face. Why this is relative contraindication? Because in some cases vertical pull chin cup are given in cases of uh, long face patients, that is patients who are vertical growers or hyperdivergent. Now, what is the line of direction of force? There are two ways to use the chin cup. So, this line of force acting directly through the condyle with the intent of impeding mandibular growth in the same way that extraoral force against maxilla impedes its growth. This method caused no opening of the mandibular plane angle. So, in this, there is no opening of the mandibular plane angle. The second is line of force acting below the condyle. So in this, the chin is rotated downward and backward, and the chin is rotated downward and backward. So there will be obviously increase in the facial height for for a decrease in prominence of the chin. So that's why in indication it was written that it is not used in height, short facial height patients, because when the line of force is below the condyle, the chin is going to rotate downward and backward, which is ultimately going to increase the facial height. So if already the patient's facial height is more, it is going to increase more and it is going to worsen the case. Now, when vertical force on the acts on the chin, so there will be decrease in the mandibular plane angle, there will be decrease in the gonial angle, and there will be increase in the posterior facial height. Now, what are the types of chin cup? So there are two types of chin cup: the vertical pull chin cup and the occipital pull chin cup. So occipital pull chin cup, why the name is given so? Because it derives its anchorage from the occipital region of the head. So here you can see in the picture that the anchorage has been taken from the occipital region of the head, and it is the most commonly used chin cup. So what are the indications? It is used in class 3 malocclusion with mild to moderate mandibular prognathism and slightly protrusive lower incisors. The vertical pull chin cup. So why the name is given so? Because it is deriving its anchorage from the parietal area, that is the superior portion of the head, right? And the indications are patients with steep mandibular plane angle. So here you can see in the picture also that the patient has steep mandibular plane angle, and it he also has excessive anterior facial height than the posterior facial height. So in these cases, the vertical pull chin cup are given and the patient with anterior open bite also. Now, what is the fabrication of chin cup? They are either prefabricated or custom made. So what are the steps? First, you have to take an impression of the chin area using alginate or impression material. Then the cast has been poured. Here you can see in this picture the cast has been poured, and the fabrication of this chin cup is done using the self-cure acrylic resin. Right? So both this acrylic resin chin cup is also there in this picture with the cast being poured. So what is the force magnitude and duration of wear? So in orthodontics, there are usually two forces used. First is the orthodontic force and the other is orthopedic force. The orthodontic force has been used mostly in cases when you have to achieve desired tooth movement. But orthopedic forces, these are over 400 grams, right? Used for orthopedic appliances. So obviously the force will be more than 400, but when you are going to deliver the appliance, the force will be 150 to 300 grams per side, and over the next 2 years, the force will be increased to 450 to 700 grams. The wear time will also be more, that is 12 to 14 hours a day. Now, what are the effects of chin cup therapy? Yes, definitely it will, redirect the growth of mandible, that is in downward and backward direction, which was forward, that is in skeletal class 3 patients. Then remodeling of mandible will be there. Yes, there will be decrease in mandibular plane and gonial angle. Lingual tipping of lower incisors can be seen due to chin cup therapy, and this was the reason why in indication it was written that you have to use the chin cup in patients which who has normal or procline lower incisors and not retrusive lower incisors, because the effect of chin cup, it causes lingual tipping of lower incisors, so it will worsen the case. Obviously it will have improvement in skeletal and soft tissue profile. Now, what are the commercially available chin cups? The first is soft elastic appliance, Hickam type appliance, Unitech design, and Summit design. So these are the references from which I have taken this content. Thank you.